While suffering occurs throughout Chattanooga, it is intensified when someone is hospitalized. There is physical pain, frustration, hopelessness, anxiety, depression, loneliness, isolation, grief, and spiritual crisis.
Medicine traditionally has dealt with the physical needs of patients, and we do that very well. But when it comes to the spiritual, emotional, mental needs, we're not very good. A lot because we're not trained very well in those areas. Because of that, I think the medical community very much needs people who are trained in the area of spirituality and emotional and mental needs.
That is where the Chattanooga Association for Clinical Pastoral Care has a role to fill. Patients need a spiritual advocate, someone who has the training, compassion, and knowledge to comfort, support, embrace, recognize, and take action. The Cacpc offers a program designed to provide clinical pastoral education to people called to spiritual ministry and to persons who are considering such a call.
I think the CPE program is one of the best programs I've ever been in. I think that every minister, every pastor should participate in CPE. I think it will be good for them, and what they learn for themselves will be of value to those that they minister to.
This unique program offers training in spiritual and emotional support in diverse settings to sick and injured people, their families, and others seeking assistance.
My husband had surgery several times here, and to know that this care, this pastoral care that we have, could come in and pray with him and let him know that they're for him. It comforted his heart, made him feel more at ease to have his surgeries.
Pastoral ministry in a hospital setting is one of the highest callings a person can be asked to perform. Placed in the midst of suffering, these dedicated individuals are there to remind the patients of their value and goodness, as well as the constant presence of God in their lives.
I think when an untrained chaplain comes into this hospital, he has two big problems. The first one is he may not understand the illness. The other is he doesn't really know how a hospital works. And if they don't have some understanding of those things, it's very hard for them to minister to their parishioner the way they want to.
Students get a supervised learning experience in a training facility. The program is accredited by the Association for Clinical Pastoral Education, Incorporated. Students begin to make a difference right away while gathering real-life knowledge. The integration of medicine and other sciences with theology confirms that spirituality is an essential component of wellness. Students will gain an understanding and insight that they can take with them for the rest of their lives.
I wish everyone could go through clinical pastoral education, at least the experience I have. It changed my life. I chose life because of my experience. I've learned how to be with people and not go into situations to try to change it. I've learned what I can't do as a caregiver and as a minister. And I've learned to appreciate what I can't do and go about and do what I can do. This experience has enabled me to be more effective by doing less, by simply being the presence of Christ in the midst of the people. And I thank God for the experience.
Our method of theological education is experiential, person-centered, and focuses on learning and developing pastoral skills in a clinical setting. But we need your help to continue this important work.
One of the trends we are seeing in rehabilitation across the country is that many rehabilitation hospitals are no longer having pastoral care departments. The reason for that is pastoral care services are not reimbursed. It's a program that adds so much, yet the insurance companies don't pay for it. We feel strongly in our commitment that if we truly are sincere in getting that patient back to have a functioning life that's both independent and productive, we need to provide these services. It's a service that does take money away, and it's always helpful if we can have support for some of these programs, because we are funding a program that is not reimbursed, plus we are funding students' education here at the hospital.
And with your kind backing, we'll keep on making a difference in the lives of so many people who live in our area. Another way to help is by becoming a student and learning these important skills. For those of you who are looking for clinical pastoral education, We would enjoy talking with you about your interest and helping you start the application process.
I think the importance of the chaplaincy program is the idea that we're meeting the needs of the whole person. Yes, I had a physical condition, but that physical condition spurred other issues in my life, emotionally, spiritually, issues with my family and things, and the chaplain brought into that a more complete picture of meeting my needs at every level, being in the hospital medically, but in his presence and with his involvement, I had emotional and spiritual needs also addressed, and I think that brought a more complete feeling of being taken care of and meeting the challenges of the day ahead.
Thank you for taking the time to learn more about CACPC. We welcome whatever support you can offer, from prayer for our supervisors, students, volunteer, faculty, and host institutions, to helping us locate clubs, organizations, churches, and businesses where we can share CACPC's powerful story. And last but not least, if you can consider a one-time gift or becoming a regular monthly contributor, you can provide a blessing and a positive experience for so many people in the Chattanooga region.